The Spanish flu. Imagine a storm so big it didn't knock down buildings. It knocked down people. That was the Spanish flu of 1918, one of the deadliest events in American history. It moved like a shadow through towns and cities, carried by coughs, sneezes, and the crowded trains of soldiers returning from war. Within 2 years, it infected 1/3 of the planet and killed about 675,000 Americans, more than World War I itself. Hospitals ran out of beds, coffins were stacked in hallways, schools and theaters closed. People wore masks sewn from fabric because they had no other protection. It hit young, healthy adults the hardest, people in their 20s and 30s, which made it even more terrifying. No one fully understood what a virus was, but the Spanish flu forced America to think about public health, hygiene, and how quickly life can change when the world gets sick together. COVID-19. 100 years later, another invisible enemy appeared, COVID-19. This time, the world was global, filled with planes, smartphones, and instant travel, and that made it spread faster than anything before it. It began quietly, then shut down the world. Streets emptied, offices closed, and children went to school through screens. Over 1.1 million Americans died, and millions more were hospitalized. It wasn't just a medical crisis, it was emotional, social, and economic. People lost jobs, routines, and loved ones. But it also showed humanity's progress. Scientists worked together across countries, developing vaccines in under a year, something once thought impossible. COVID changed how America worked, learned, and connected. It reminded everyone that health is shared, that one person's safety often depends on another's care. Tuberculosis. Long before antibiotics, tuberculosis, or TB, was the slowest and cruelest of killers. People called it consumption because it looked as if the body was being consumed from within. It spread through tiny droplets in the air. A single cough could infect a room. In the 1800s, TB was everywhere, from crowded cities to quiet farms, claiming more lives than any other disease. The sick were often sent to sanatoriums in the mountains, told that rest and clean air might help. Some stayed for years, others never came home. It was romanticized in novels and poems, but behind the stories was pure suffering. When antibiotics were discovered in the 1940s, TB finally met its match. For the first time, a disease that had haunted generations began to fade, proving that patience and science could win battles once thought impossible. Cholera. Now picture this, you're thirsty, you drink a glass of water, and that water kills you within hours. That was cholera, a bacteria that spread through contaminated water and poor sanitation. During the 1800s, American cities were growing fast. Streets were crowded, waste ran into rivers, and plumbing barely existed. Outbreaks in 1832, 1849, and 1866 hit places like New York and St. Louis hard, wiping out entire neighborhoods. People didn't know what caused it. Some blamed bad smells, others thought it came from sin or curses. Then came the breakthrough. Scientists discovered it was hiding in dirty water. The solution wasn't a miracle drug, it was engineering. Clean water, proper sewage, and sanitation. Cholera taught America that sometimes the best medicine is a pipe, not a pill. Smallpox. If diseases had a king, smallpox would wear the crown. It was one of the oldest, most feared killers in human history. It scarred faces, blinded eyes, and killed about 3 in every 10 people it touched. In early America, it spread through towns, ships, and native communities, leaving destruction everywhere it went. But smallpox also changed history in a good way. In 1796, Edward Jenner made a discovery that changed medicine forever, using cowpox to protect against smallpox. That was the world's first vaccine. Over the next 2 centuries, vaccination campaigns spread around the world. By 1980, the World Health Organization declared smallpox eradicated, gone, wiped off the face of the earth. It was proof that human cooperation could do the impossible. Polio. For kids growing up in the 1940s and 50s, summer meant fun, but also fear. Every year, waves of polio shut down swimming pools, playgrounds, and movie theaters. It struck without warning, paralyzing children overnight. Hospitals filled with rows of iron lungs, large machines that helped people breathe when their muscles stopped working. In 1955, Dr. Jonas Salk created the first polio vaccine. When asked who owned the patent, he said, "Could you patent the sun?" Polio cases plummeted worldwide. Parents cried tears of relief as their children lined up for vaccines. It was one of science's greatest victories, proof that collective effort can end even the darkest fears. Heart disease. Some diseases strike suddenly, others build quietly. Heart disease is the quiet kind. As America industrialized, people began eating more, moving less, and working longer hours. By the mid-1900s, heart disease became the nation's #1 killer, and it still is. It now claims around 700,000 American lives every year. Unlike a virus, it doesn't spread from person to person. It spreads through habits, diet, stress, lack of movement. But it's also one of the few killers we can fight directly. Exercise, healthy food, and enough sleep can save lives without medicine. Heart disease reminds us that sometimes the fight for life happens in everyday choices, not emergency rooms. Stroke. If heart disease attacks the body's engine, a stroke attacks the control center. A stroke happens when blood can't reach part of the brain, like a blackout in a busy city. Speech slurs, vision fades, the body stops listening to the brain. For decades, people didn't understand what was happening. Today, we know that time is everything. The faster you act, the better the chance to survive and recover. Every year, about 160,000 Americans die from stroke, but millions more survive thanks to awareness campaigns and faster emergency care. Stroke turned from a mystery into a race against the clock, one where knowledge saves lives. Cancer. Cancer isn't one enemy, it's 1,000. It happens when the body's own cells go rogue, growing out of control and refusing to stop. In the 1800s, few people lived long enough to get cancer. But as medicine improved and people lived longer, cancer became the next great challenge. Today, it kills around 600,000 Americans each year, yet it's also where science has made incredible progress, from chemotherapy and radiation to immunotherapy and genetic mapping. Cancer research teaches doctors how to teach the body to fight back. It's not a single battle, but a lifelong war, and every discovery brings humanity one step closer to winning. AIDS. In the early 1980s, a strange illness began appearing in healthy people. Their immune systems failed, and no one knew why. That illness became HIV/AIDS. At first, it was met with fear and silence. People were stigmatized. Misinformation spread. Politicians ignored it. But communities fought back. Activists demanded research, funding, and compassion. By the 1990s, new treatments transformed HIV from a death sentence into a manageable condition. More than 700,000 Americans have died since the epidemic began, but millions now live long, full lives. HIV/AIDS reshaped how America viewed health, equality, and empathy. It wasn't just a medical crisis, it was a moral one that turned fear into a global movement for compassion.